In this film, we're going to look at how to open the airway using the jaw thrust technique, which is particularly useful when you suspect neck or spinal injury or when the head tilt chin lift method might not be appropriate. When a person becomes unresponsive, the muscles that normally keep the airway open relax. This allows the tongue to fall back and block the airway, stopping air moving in and out of the lungs, so maintaining an open airway is absolutely essential. The jaw thrust is used when you need to open the airway without moving the neck, for example, after a fall, road traffic collision, sporting injury, or any situation where spinal injury is suspected. It can also be used during CPR when maintaining head alignment is a priority. If there is no concern about spinal injury, a head tilt chin lift remains the preferred and simpler method. So how do you perform the jaw thrust technique? Kneel at the top of the casualty's head. This is often referred to as the over the head position. Make sure the person is laying on their back on a firm surface. Rest your elbows on the surface beside the casualty's head to give stability. Then place the index and middle fingers of each hand behind the angles in the lower jaw just below the ears. Using a firm but gentle motion, lift the lower jaw upwards and forwards towards the ceiling so that the lower teeth move in front of the upper teeth if possible. This movement pulls the tongue away from the back of the throat and opens the airway. Be careful not to tilt or extend the head. The goal is to open the airway while keeping the neck in a neutral position. With the airway now open, look for chest movement, listen for breathing sounds, and feel for air movement on your cheek for no more than 10 seconds. Finally, this technique can be physically demanding, especially to maintain over time, so swap to another trained rescuer if available. If the person is breathing normally, you can maintain the airway by keeping the jaw thrust in place until help arrives, or place the person in the recovery position if spinal injury has been ruled out. If the person is not breathing normally, leave the airway in an open position and begin CPR. The jaw thrust is a simple but vital skill that helps keep oxygen flowing to the brain and heart when every second counts in the spinal emergency.